Hi, thank you for joining us. I am Cecilia Arredoza. I'm with the Biden Cancer Initiative, and I'm here today with Kim Thiboldeaux of the Cancer Support Community. We're going to tackle a very uncomfortable, awkward, but exceptionally important topic. How do you have difficult conversations about cancer, about the cancer journey? And Kim has done this endless times for endless patients and families, and we can learn so much just from her experience. So let's dive right into it. Kim, tell us a little bit about the Cancer Support Community, what you represent, what you're able to provide patients all over the country.
Sure. So Cecilia, I'm so happy to be with you today to talk about this important topic. At the Cancer Support Community, we provide support, education, navigation, nutrition, exercise for people with all cancers at all stages of their disease. We provide these services at 47 centers across the United States and even around the world. We help patients and family members through our helpline and are doing also quite a bit online in our digital community to serve patients and families. Everything we do, by the way, is free of charge. In the past year, we have provided over $50 million in free services to patients and families.
So cancer diagnosis is one of the most frightening news that you can possibly absorb. How do you absorb it? Who do you talk to? Let's start with parents who have kids who have just been diagnosed. Where do they start? Who do they have these conversations with?
There are so many wonderful professionals out there who can help you plan for that conversation with your children. We work with a lot of parents at the Cancer Support Community. We have a great book called What Do I Tell the Kids when Diagnosed with Cancer. The important thing about talking to children about cancer is that you do so in an age-appropriate way. What a 5-year-old can understand about a cancer diagnosis is very different than a 15-year-old. So it's important that you have an age-appropriate conversation with children about cancer. It's also important that you look for signs in your child that they're not processing things well or understanding things well. Are they regressing? Are they showing bad behavior? Do you see changes in their sleep, in their mood, in their behavior? You have to sort of note those things. And in some instances, really see a professional counselor or a social worker to help the family and the child through the difficult situation. We also recommend, if the parent feels comfortable, to talk to somebody in the school about what's going on in the family. Look, our kids are in school all day long, right? Teachers and other folks in the school are going to maybe note changes in behavior. They can report that back to the parent so that you can make a plan. You know, we also tell families, look, it's important to try to keep the kid on schedule, keep things normal. It's important to keep the rules in place. Sometimes we think, all right, maybe we can fudge and suspend the rules a little bit. It's important to keep the rules in place, keep the routine in place, and also be very open with the child and the family about cancer. You know, Cecilia, a couple of myths that kids hold about cancer that's important to address. A lot of times children think it's something they did that caused the cancer. Oh, you know, I hate you, mommy. Or, you know, you told me to clean my room and I didn't clean my room and now mommy's sick. Is it somehow my fault? So that's something you have to address with the child. Sometimes kids think everybody dies from cancer. So it's important to be open and realistic, but also to be hopeful with a child that I'm gonna do the best I can and my doctors are really helping me and we're really gonna get through this together as a family and I'm gonna do the best I can and we're gonna be together during this time. So it's important to address those kinds of issues. A lot of kids think cancer is contagious. So maybe they distance themselves from the parent because they're concerned, well, mommy's sick or mommy lost her hair. So if I'm too close to mommy, like I can catch a cold, maybe I can also catch cancer. You have to dissuade them of these myths. Kids know more than we think. They're so smart and they know more than we think. So you should really be open with them and have these age-appropriate conversations.
I mean, it's so easy nowadays to just Google it. And the last thing you want is for people to kind of create their own assumptions based on all the information that's out there. And how do you sort through that? How do you make sure that people are absorbing the right types of information at the right time?
Well, sometimes I do tell people to step away from Dr. Google because it's so overwhelming, the information that's out there. And it is hard to know who to trust. I know that some of the work that we're doing together is really bringing together wonderful advocacy organizations around the country. I want folks to know that these advocacy organizations are really trusted sources of information. They bring in medical advisors, they're vetting the information. In many ways, they're doing the work for you. And so trust these organizations, talk to your doctor. Make a list of questions. Take those questions into your doctor. Take good notes. Really be prepared for your medical appointments and conversations. Your doctor's your expert. It's important that you have a good, open relationship with the doctor. And not only the doctor, the entire healthcare team. Think about our wonderful oncology nurses that are out there. Sometimes those are the folks who are going to answer our questions. But I always tell folks, take your time. One of the other things that's important for folks to know is, based on what kind of cancer I have, do I have to start treatment right away? Is this an emergency? Do I have a couple weeks? We tell folks, get a second opinion, maybe go to an academic center. So write down your questions, take your time. And we always tell folks to take someone into the medical appointment with you. A second set of ears in that appointment is so important and so helpful. Again, maybe somebody to help take notes, write the questions, write the answers. And I also think it's important, I think folks get intimidated in those doctor's appointments. And I want to remind people, this is your appointment. This is your agenda. That doctor's there for you to help you. If you don't understand something, say it. Wait, what was that word? Can you spell that for me? What does that phrase mean? I think it's important that folks feel comfortable in those doctor's appointments. They feel open and they feel like they can ask the questions and get the answers that they need. One other thing I tell people is, at the end of the appointment, say to the doctor, if I have more questions after I leave here today, who can I contact to get answers to those questions? Because inevitably you're going to leave that appointment and you're going to think of 5 more things. Oh, I wish I had asked the doctor this or that. And it's important to have a contact in the office where you can continue to get the answers that you need.
So what I'm hearing you say is that we absolutely need to have that trusted community of advocacy organizations, your healthcare providers, your physicians, your nurses, your social workers, and kind of your network of support at the ready. You need to prepare, have that list, have your notebook at the ready, be able to filter information the right way. If you can have somebody else there with you at every appointment, have a much more objective person. Any tips for us on how you actually start that conversation? Let's just say the parents or the mom or dad was just diagnosed with cancer. How do you broach this topic to your family, whether it's your children, your siblings, your parents?
Some folks say that they want to sort of have enough information first to be able to answer the family members' questions or the children's questions. So they want to get through maybe a few appointments. So what is my diagnosis? What is the treatment going to be? What are the side effects? So that you can talk to your family in sort of an educated way so that everybody knows what to expect, during the cancer journey. A lot of times I hear folks say, we're going to have a weekly family meeting about this. So let's sit down. We have some information that we want to share with you, some news that we want to share with you. Mom's sick. She has something called cancer. We have very good doctors. They're going to help us through this, and we need to unite as a family to really help mom and be a part of getting mom well again. And explaining, again, depending on the age of the children, just explaining what is cancer, explaining the treatment. One of the most difficult side effects of cancer treatment that kids struggle with is hair loss, because that's
obvious.
Very obvious and a very visual representation of the illness. And so for some kids, that's very distressing. For other kids, maybe the parent doesn't look as well. Maybe they have lost their hair. So for some children, they don't want their parent to be around their friends. They don't want their friends to see their parent in that sick state. So you really have to adjust to each child and each family member and talk to them and help them understand what's happening, understand who the doctors are. Some parents like to take their kids to the cancer center to see what's going on and to meet the doctor and to know that there's a good team. Again, these are very personal decisions for folks. Sometimes with older children, you're going to have to ask them to step up a little bit more. You want to be careful not to make a teenager assume the role of an adult or the role of a parent, but say, hey, look, I'm going to need you to wash up the dishes. I'm going to need you to babysit your sibling. I'm going to need you to be on the team and really be a part of what's happening here. We find that being a little more open, more transparent, more honest, and letting the family be a part of the process and participate in the process helps with quality of life. It helps with things like distress and depression and anxiety for all members of the family. Cecilia, the cancer journey is as hard and sometimes harder on the caregivers, than it is on the patient. We just did a study at the Cancer Support Community that showed that a significant number of caregivers had higher levels of distress, depression, anxiety, sleep disturbance than the patient, that the caregiver is suffering more from this. In some ways it's logical, right? The patient can say, I'm not getting out of bed today. The patient can say, I'm not taking any calls today. I'm not going to work today. The caregiver has to keep going. Got to get up, got to get the kids out, got to go to work. You got to take care of the patient. You got to take care of the loved one. And you got to keep, you got to just keep going, keep going, keep going. we find by the time maybe they get to our support groups at the cancer support community, the caregiver groups are sometimes more emotionally charged than the patient groups, because maybe that's the first place that they can really let their hair down, and the first place that they can really be honest and speak honestly about the situation without anybody judging them. Look, your husband's still your husband, right? He can be a pain in the neck sometimes, right? But you couldn't say that to people if he has cancer, right? But you need to be able to share those true emotions. I remember we had a caregiver in Philadelphia, a woman who was taking care of her sister, and her sister was literally in a hospital bed in her sister's home. Her sister was married, had 2 kids, and she was dying. And the sister who was taking care of her felt terrible, obviously, about the situation. But in the caregiver support group, she said, you know what? All I want her to do is say thank you. And you just get this rush of emotion, it's that simple sometimes, But she couldn't have said that to anybody else. Her sister's dying, right? It's a very emotional situation. But the fact that she can come in, connect with other caregivers, be a part of that conversation and say, that's all I want. It's pretty simple. I can't tell her that, but I can tell you guys that, and feel comfortable and get that off of her chest, So these connections that people are making with other patients, with other caregivers, are so critical. That sense of community is so critical in getting through the cancer journey.
And you bring up a really good point, how we need to always think about helping the helpers, supporting the supporters, because it takes that and then some to be able to get through this cancer journey. As you think about all the small decisions, it's not just one big decision that you have to make. How do you talk about the hope that is real?
Right.
As well as some of the realities that are just not comfortable.
We certainly deal with a lot of patients who are in end of life, who maybe have metastatic disease, advanced disease, patients who may not live to see the year out. Mm-hmm. And those can be those pivoting conversations can be very difficult and challenging. But it is so important that we have those conversations. Cecilia, there are guidelines that actually recommend that when a patient is terminal, when a patient has less than a year to live, the doctor should be talking to that patient about an end of life plan, about palliation, about pain management, about quality of life, and frankly, advanced care planning, right? A living will, a do not resuscitate, all of those things that come along with that planning that comes in end of life. So there's the medical side of that conversation. And also the side of, when is the patient ready to end treatment? Because sometimes patients say to us, they feel pressure from the doctor, they feel pressure from their family, they don't want to feel like they're giving up. But I remember one patient said, I don't want my wife to think I'm giving up, but I just need her to understand that I need to let go. And I need to make this change. I need to end treatment. And I need to move on to this next phase. And I know I'm going to die, but I'm ready to do this, and I'm ready to end treatment. And so you really have to empower the patient to make that decision and give them the tools. You have to address the medical side, right? How are we going to make sure this patient's pain and other side effects are managed? A good palliative care plan that we talk about. When do you bring in hospice care? Things like that. But the other side of the coin is to think about honoring the wishes of the patient, and to think about the dignity of the patient, and to think about, in this patient's remaining months or weeks, what are the things that are going to be important to them in that time? Do they want friends to come and visit and say goodbye? Do they want to go through some old photos and make an album? Do they want to write down some stories? Some people like to write cards, for their children, grandchildren, for special occasions, and leave the cards. So it's important to have the medical side of the conversation, but also the, emotional and existential side of the conversation, to make sure that we are honoring that person's wishes in every way that we can, from the medical and the DNR to the legacy that person wants to leave behind for their loved ones.
These conversations can be very emotionally charged. Yeah. What are some of the time-tested approaches you've seen that has worked in kind of managing emotions in a way that they can channel their fears, they can channel the kind of the frightening nature of this disease to just keep on going?
We always tell people, don't let perfect be the enemy of good. I mean, there is no formula. There's no perfect way to have this conversation. And so what ends up happening is people avoid the conversation until sometimes it's too late, to have this discussion. So we say to folks, look, you just have to sit down and dive in on the conversation. And it's fine to say, this is really hard for me. It's fine to say, it's fine if you get emotional. It's fine if you cry. These are difficult and hard issues. And sometimes I think in our minds, we think, okay, we have a way that we want this to go, and we have a formula, and it kind of never goes down the way that folks want it to go. But what I like to say to folks is, don't avoid the conversation. Sit down and have the conversation and say, this is difficult for me. Put some thoughts out on the table. Look, I want to talk to you about plans. I want to talk to you about what you want as you come towards the end of your life? What's important to you? How does that make you feel? You know, what is your reaction to that? Are there things that have been going through your head that you want me to know? Things that are important? How do you want to talk to our children about this? And like I said, you're not going to get it all done in one meeting, right? You're not going to get it all done in one sit down. It's going to kind of ebb and flow. You know, it's going to come in phases. But sometimes you, as the caregiver or the loved one, need to be the one to continue to bring it up with the family. Or sometimes it's the patient, you know, that brings it up. But when it comes up, you as a family need to allow room for that conversation. You also need to allow room for the person to change their mind, because that happens a lot. We think we know what we want, and I always find it interesting when people say, well, if I was in that situation, this is what I would do. We don't know. We don't know what we would do. You know, self-preservation is our deepest human instinct, right? And so to be in that position and to think we would know what we want or what we would do, it's just false. You can't really do that. And you have to give, I mean, I see people say, well, I think I'm gonna end treatment, and then they say, well, I'm gonna go a couple more rounds. I'm gonna just try a little bit more. I wanna fight a little bit more, or I wanna see if I'm gonna have any progress, you know? Or I see plenty of patients who say, I'm done. You know, I wanna end this. I wanna have the next couple months or a few weeks or whatever that looks like. I want it to be have a good time and be a peaceful, nice time with my family and have conversations. You know, Cecilia, I was talking to a young man out in California a few weeks ago, and his father was dying of pancreatic cancer. And I think he knew the reality. I knew he knew his father was gonna die. He was looking for some other options, treatment options, and they weren't there. And as a result of that, he knew that there were some things he needed to heal with his father. You know, he knew there were some things that he needed to address. And I said to him, this is the time to do that. This is the time for you to sit with your father and address those unaddressed issues, address those things that have created this gap between the two of you. You have the opportunity to lead this, and you will feel for the rest of your life so much better if you make this effort. Well, you know what he did? He did that. And he called me the day after his father died, and he thanked me and said, I did exactly what you said to do, and I feel like a whole, complete person now. There's nothing hanging out there anymore. It's not lingering. It's not going to haunt me. And I know I can move on with this next part of my life, you know, because I got those things settled with my father. And it felt great. It was a sad story and a sad situation, but to know that he took that effort and had the outcome that he hoped for and had no regrets. And I think whether it's the patient or the caregiver, I think a lot of us in life, we don't want to have regrets, right? And that's what I hear patients say is, you know, I don't want to have any regrets. I don't want to have this be a wake-up call for me. I want to do the things that I want to do and make the choices that I want to make. And I appreciate when patients take that approach and have a realistic approach to their end of life. Sometimes the patient's much more realistic about things than the family, you know, than the family is. And I think you really have to trust the instincts of the patient. You want to make sure they're making decisions with their eyes wide open and well-informed decisions. But at the end of the day, you really have to respect their wishes and allow it to be their decision.
Every cancer experience is very personal. It's very unique to every patient, every family, every community, but it is not isolated. And I think that right there is one of the kind of the tenements of this experience, because you can have very personal narratives, but be able to share that. And I think having that support network, having someone to turn to, having caregivers who can understand what you're going through, and being able to turn to those people when you need it most, and sometimes even when you don't think you need it.
You know, Cecilia, so much of the literature that we read in our field shows that regardless of what kind of cancer you have, or even in some ways the stage, that there are three common things that cancer patients experience: a loss of hope, a loss of control, and a sense of isolation. So that is an elevated experience that goes across all different types of diagnoses, right? So if we can figure out whether we're the cancer support community, the Biden Cancer Initiative, whether we're the neighbor, the friend, how do we give somebody hope? How do we help them take back some control over their illness? And how do we help them not feel isolated and alone, you know? And those are kind of three pretty basic principles that no matter who you are in that patient's life, you can kind of help to bridge that gap for them.
Thank you so much, Kim, for all of these nuggets of wisdom. You know, having these conversations about your cancer journey are it's difficult, it's emotional, it is heavy, but it is incredibly important to have them early, have them often, and have them in a very candid and authentic way. Please turn to all the resources that are available to you. Find that network that can support you, and figure this out, not by yourself, but turn to the community that is there at the ready to support you. Thank you so much for joining us.